Hi, this is Dr. Jason Dulac coming to you from my office, Dulac Dental of Springfield in Springfield, Virginia. Today, I wanted to talk to you a little bit about periodontitis or periodontal disease. We spoke recently about gingivitis. Gingivitis is gum inflammation. Periodontitis or periodontal disease is gum disease. So what do we mean by that? The bone and attachment around the teeth has started to pull back away from the teeth. Once we lose that bone, we can't get it back. We can only manage it. So if you have gum disease or bone loss around the teeth, come in, we'll do some gum measurements, clean all that stuff out that's in there. We can then go down in the pocket that gets created from the gum pulling back away from the tooth with a laser and some irrigating solutions to disinfect and kill off the bacteria that are down in the pocket, allowing the gum tissue to reattach to the tooth. We do have a laser in the office. I have some other videos on laser if you want to learn more about that. But following the removal of the bacteria that's causing the gum disease, the gum will reattach to the tooth. There are some factors that place you at higher risk for gum disease or periodontal disease. Diabetes is a big one. A lot of our patients have enhanced cleaning benefit, or if we tell the insurance company that you have diabetes, because there's a high link to gum disease and they know that that needs to be managed, you'll get extra cleanings per year. So that's something we always identify on the health history, and we always reach out to your insurance company to see if they'll give you enhanced cleaning benefits. So the treatment for periodontal disease or gum disease is to get the bacteria out. We can't get the bone to come back. We can get the gum to reattach to the tooth, but getting the bone to come back is challenging. So the main thing is managing it, preventing it from getting worse. And we do that by cleanings every 3 to 4 months. So once you have gum disease or periodontal disease, we can manage that, but we can't ever cure it. So it's kind of like high blood pressure. You manage it, curing it is much more challenging. So we want to get in there once, clean it all out. That's called the scaling and root planing or deep cleaning. It includes numbing because it would be uncomfortable to do that without numbing. So we numb you up, get you nice and comfortable, get all that stuff out of there, get back to a fresh baseline, we'll probably give you a prescription mouth rinse. Moving forward, we then need to manage that from coming back. And we do that by cleanings every 3 to 4 months. There's a certain type of bacteria that causes gum disease. This bacteria doesn't actually grow on the tooth itself. It grows on other bacteria that are already on the tooth. So if we get in there every 3 months for 95% of the population, that'll keep things stable. If we go past that, those bad bacteria build up again, start to cause damage and destruction again. You start to get bone loss and gum loss again, and the gums start to get irritated and inflamed again. So once you've done that initial therapy of scaling or root planing or the gum treatment, super critical to stay on the 3 to 4 month maintenance. If you let that lapse, it will relapse. We will have to do or redo the scaling or root planing or deep planing. So super critical to stay on that 3 to 4 month maintenance and be good about your home care. There's really only 2 groups of people that don't respond well to that therapy. One is smokers. So in addition to all the other bad stuff smoking does, cancer, all that, it also places you at higher risk for managing or controlling the gum disease. So that's, it's a hard habit to break, but it's something you could consider trying if you're having unresponsive periodontal disease and you do smoke. The other thing is diabetes. Diabetes makes you higher risk for all kinds of infection and makes it harder to heal. And so some diabetics have trouble managing that. The best way to manage that is to get your blood sugar down to an appropriate level. So an HbA1c or like a long-term blood sugar management level for normal people, healthy people is 6. If you're a diabetic and you can get your HbA1c down in the 6 range, you'll be in good shape. I've had patients come in with HbA1c at like 11. So that is going to cause so many problems. Just get that under control with your doctor. There's so many therapies now. They've got all the injections, so Wegovy, Ozempic, all that stuff. So there's a lot of good options now to help you bring that blood sugar down, which will help not only your overall health, but your dental health as well. If it's left untreated, eventually you'll lose enough bone that the tooth will become mobile and painful or might die and will have to be extracted. So it really is critical to catch this early and manage it. And you do that by frequent visits to the dental office. Every time we clean your teeth, we'll reassess like how the gum health is and advise when your next cleaning should be. So for about 2/3 of the population when they're younger, it's every 6 months. As we get older, a lot of patients need a 3 or 4 month maintenance. In later decades of life, dexterity becomes hard. You might have issues brushing or flossing. That would be a reason. But whatever we're seeing that's going on there, whether it's because you haven't been on top of your home care, or there's an underlying health issue, or there's some dexterity issues and it's harder for you to brush and floss now, at every cleaning, we will reassess the gums, see where you're at, and recommend when you should come again. I know sometimes it's, annoying to pay for a cleaning when your insurance company only pays for a couple a year, but, most patients, the cost for a cleaning is like $80 or something like that with their insurance. So that one extra cleaning per year could help save you from all this gum disease and destruction in the bone. There is a high correlation of gum disease to a number of other things. It either, not necessarily cause, but worsens heart disease, strokes, some types of cancer, lung conditions, pretty much everything bad you can think of that you can get is worsened by gum disease or periodontal disease. So that chronic inflammation or infection in the mouth that's getting into the bloodstream, that bacteria gets in the bloodstream, goes around the whole body, deposits on heart plaques, in the joints, just everywhere. It raises the inflammation throughout the body. And that causes a cascade of other problems. It makes it harder to control blood sugar. There's so many things that are caused by or worsened by having that chronic infection in your mouth. We talk about the mouth as kind of the gateway to the body. For some reason in medicine, it's kind of been separated from the rest of medicine, but periodontal disease or gum disease is one of those things that causes a number or worsens a number of other health conditions, and staying on top of your gum health will help with your overall health as well. So super critical to maintain frequent visits to the office so we can assess the gum health, keep the gums healthy, and help you prevent not only bone loss around the teeth or tooth loss, but also your overall health. I hope this answers some of your questions about gum disease or periodontal disease. If you have any questions, give us a call at the office, 703-451-4500. Thanks.